Health, they say, is wealth. Thus, they need to ensure that there are friendly policies that will affect workers and the ordinary people positively. Hello and welcome to Labour Lens. I am Sharon Ijatson. On this week's episode of the program, we have interesting news stories for you. We'll also be focusing on the issue of the proposed hospital concessioning. We will be right back.
If possible for governments, let them go back to what we were before, the NEPA that we used to know. Because this group, they are just exploiting us, paying what you don't consume, estimating you, even when they knew that you are not using that light. At times, they'll give some shops 22,000 when you are using only fan and the television.
Abdullahi Suleiman is a young artisan trying to earn his living here in Lagos. I met him while on the quest to sample people's opinion on power supply situation in the country. He tells me he spends more than 5,000 naira daily to purchase petrol to fuel his generator set for power to run his business.
People don't have money to even start gen, some people. So that's it. And my business is all about light. If there's light, I will have more customers. I have to on my AC, but without light, my gen can't take the AC, and I'm losing customers for the past 1 week now. There's no light. That's why I have to go and get food. And how much am I even making in this barbing salon? So when I go and start gen now, before I know, customer will come in. I bar finish. After some time, I'll have to go and get another fuel. So sometimes at night we come here, we work. Does not even work sometimes. We stay till 9 o'clock, 10 o'clock, that fuel is gone. And every month, NEPA will come here and start collecting money. They want to collect money, they'll be shining eye.
While at the barber's shop, it was observed that the electricity supply in the area is so poor that neighbors come around to power their phones.
I don't stay in this area. At my area, there's no light there too. And me, I don't like sleeping in the darkness. I have to on my torchlight, my phone torchlight, I'll on it down. I'll just be monitoring them when they on their lights. So I'll be running up and down. I'll be watching them if their lights, their gen is on. And I'm going to charge my phone.
The General Secretary of the National Union of Electricity Employees, Joe Ajero, highlights some of the grouses the union has with the federal government, prompting a 21-day ultimatum.
Nigeria cannot come out of poverty line with this because electricity is closely related to industrialization. And with no electricity, we are deindustrializing the country. And with that deindustrialization, poverty will continue to be everywhere. So it is a merry-go-round in terms of poverty. You can't have a rich nation, that is not having power supply. It doesn't happen. It is a human rights issue. People need electricity to survive. People need electricity for social service in the first instance, and you need electricity for industrialization. Now what we saw was that the new investors are only interested in electricity as an economic activity where they will maximize profit. It doesn't really matter if there are villages and communities that don't have electricity. It's not their business. It doesn't matter if there's any school or any hospital that doesn't have electricity. Whether patients are dying, it's not their business if they are not going to recoup their profit from such areas. So that's the problem, and that's the challenge we are having that we must all face.
The Nigeria Employers Consultative Association, NECA, has faulted timing of the announced increment of value-added tax by federal government from 5% to 7.2%. Timothy Olawale, NECA's Director General, said that the benefits of the recently signed national minimum wage of 30,000 naira will be neutralized by the proposed increase in the VAT. The Federal Executive Council on September 11th approved 7.2% as the new VAT rate for the country, up from the current 5%.
We know it is an avenue for government to shore up its revenue, but at what expense? When you increase value-added tax from 5% to 7.5%, who bears the brunt? And we had advised government that, look, you should target some luxury goods, not the basic consumption goods that will affect the masses. Of course, now we have seen there is a blanket increase of 7.5. And that increase now will encroach on the purchasing power of the masses.
It is believed that the increment would further reduce the purchasing power of the citizens, lead to increase in prices of goods and services, increase inflation rate, and further contraction of the economy.
Health workers under the Joint Health Sector Union JOHESU and the Assembly of Healthcare Professional Association recently condemned and rejected the approval of concession of health facilities by Infrastructure Concession Regulatory Commission (ICRC). The ICRC had in August 2019 granted the Federal Ministry of Health the permission to concession 22 tertiary hospitals and selected teaching hospitals. They are to be run on a public-private partnership basis with the aim of improving access to quality healthcare services. But key players in the healthcare sector have divergent views on the development. Many believe that Nigerian citizens will not be able to access or afford healthcare and its major components like safe drugs in public health facilities.
Hospital concession in Nigeria is just a way of denying the common people healthcare services in this country, because you must not put hospitals into a profit-making business. Hospitals, healthcare is supposed to be for social services. The moment you concess hospitals, obviously the marketers, the business people will come in to use the hospital for profit making. And when that is done, the common man cannot access healthcare services in this country. And it is the worst thing any leadership, any government can do to the citizens they are leading.
When the news broke out, my own thinking was that I don't think that the president of the country is aware of the program. It's like it's the usual cabal setup, because president having vowed that he is for the ordinary citizens of Nigeria cannot condone such program. So even if not that you're asking me, I wouldn't have even commented on it, because I know the president that we have now, who have promised us is for the poor, will not allow such to happen. Because concessioning, you know what it means. It means taking health care out of the reach of ordinary man in the country. So as a labor leader, we cannot condone such, and we will not accept that. So like I said, until we get the response of the presidency, we'll know the next line of action to take. But for now, I see it a program already dead on arrival.
In 2005, there was a national drug policy which advocated accessibility, affordability, and efficacious drugs in Nigeria's healthcare system. At a time that life expectancy of a Nigerian is put at 54.5 years due to prevailing challenges in the healthcare sector, many are of the view that concession of hospitals will only worsen the situation. This, according to some of them, is because more Nigerians will not have access to affordable and safe drugs. In a similar vein, life expectancy will be jeopardized when the cardinal goal of national health policy, which also seeks accessible and affordable healthcare services.
In my own opinion, presently I think General Hospital is working, is functional now. And before you can decide on privatizing it, there might be an issue. But as it is now, I don't know in the past, but now I don't see any issue why it should be privatized, because they are functional, they are working. It's working now. I use General Hospital. I use it. I don't have any problem with them, except maybe in terms of finance, maybe they are not remitting to the government, I don't know. But in terms of service, I think they are doing well. So I don't know the reason why they want to do that. I don't know the reason. Maybe on another issue.
I don't think government should privatize all these general hospitals for now. because if you think about the way people need to access good health facility, and everybody knows that for you to access good health facility, it requires you to have money on your side. So, and if government privatize this, that means that all the services that people are enjoying from the government hospital that are being subsidized. Like if you go to a general hospital now to access good health care, you are not going to pay. For you to get a card, at least they will give it to you free. For you to seek doctor, they will not ask for service charge or consultant fee. You will go in, they will attend to you. They will not discriminate. So by the time this thing has been privatized, then for you to get a card will require money. For you to see a consultant, you will pay. For every service you are expecting from them, you have to pay. So the government should think very well before they can be thinking that they want to privatize our health institution. I don't think we are in the right stage now to do that.
You are going to get the services that you want. Are you with me? And come to think about it, nobody is in charge of your health. You are the one in charge of your health. Are you getting me now? So, but in addition, if we can all subscribe into all these health insurance scheme, are you getting me now? I mean, part of your salary, you contribute into that health insurance scheme, and those ones now, they will be the one that will be paying for you. Not that you will be paying whether privatization or whether it is being owned by government, but the moment you are participating in health insurance scheme, definitely that's your bill will be settled, because it is a fund that everybody is subscribing into. All of us, we cannot get sick at the same time.
On the profile interview segment this week, I will be speaking with the president of the Medical and Health Workers Union. It tells me that if the public hospitals are concessioned, it means that affordable health care might not be a possibility for workers and the ordinary people. It's good to have you on the program.
It's a pleasure to meet you again.
A lot has happened in the labor sector and in the healthcare sector. I would like you to share with us. Top of it is the implementation of minimum wage. What will be your expectations from state government in terms of ensuring that your members earn a living wage?
Thank you so much. I think looking at where we're coming from, where the minimum wage at the lower end actually was 66.6%, but for the fact that we have also considered so much and brought it down to the highest point at 23.2%, I think we have shared a lot, and so I'm not expecting any difficulty from state governments to as regards the implementation of it. I accept political leaders that do not have the political will as well as love for their citizenry. One important thing why the state governments ought to make it a top priority is that this will also lift lots out above the poverty line. This will also go a long way to stimulate the various economies and then aggregate the nation's economy towards a growth path and then towards a greater GDP for the nation.
Okay, so moving forward, it's public information that we have a lot of your members in the healthcare sector that actually work overtime, and many of them have been overstretched. What's your message to relevant hospital management, probably state and federal government, in terms of ensuring that probably the portals of employment is being opened and they employ more people into the system?
Oh, thank you. That's a very good one. You see, I've been clamoring, and we and my sister unions and myself in the health industry, we've been clamoring that our members are being overstretched, and we need employment. There are some state governments that have placed embargo on employment for the past 10, 15, 20 years. And then those who are in service are also retiring. So you can see that the workforce is shrinking, whereas the population is growing, thereby increasing the ratio between a worker, a health staff, and the number of persons he should have been servicing. And when that happens, when you over-labor a person, apart from the fact that you are now gradually subjecting that worker to slave labor, you are also reducing his capacity to give in his best. And sometimes such fatigue can cause some unintentional negligence, which might also be very adverse to the patient.
From your observations, is there anything that the union plans to do or is doing at the moment to ensure that maybe there are palliatives or there are better means of ensuring that your members actually have a conducive environment to work?
First and foremost, I would want to say that more hands should be employed. In addition to the increased hands, infrastructure is also another problem. Equipment and infrastructure is also a problem. But while we are looking at that, the incentives, another incentive, great incentive that is needed is the pay package.
So what is the solution to this brain drain that is actually happening in the healthcare sector in the country?
I think what government needs to do is to ensure that, because like I said, once you make the environment conducive for someone to discharge his duties, it becomes attractive, certainly. Becomes attractive. Sometimes it may not just really be what you pay the person, but when the person goes to his point of duty dispensation, all right, he is required to give service to 10 persons, and he has 10 persons. And he feels that, okay, he now gives his best to these 10 persons, and he gets the positive results. That goes a long way. Sometimes you have the technical know-how to save the life, but because the place is ill-equipped, all right, the person has been referred to a distant place, and you know too well that that time that has been taken out of from one point to the other could also cause the death of the patient.
There's this issue of 22 hospitals bid for concessioning. What's your union reaction towards this development?
Well, thank you. That's a very big question. That's not just my union, not just JOHESU, but the entire Nigerian people ought to really answer. But I want to equip Nigerians before they answer it. First and foremost, concessioning is not a positive prescription for Nigeria. These concessionings, PPPs, privatization, commercialization, all these are embodied in what they call the PFIs, Private Finance or Financing Initiative. These are initiatives that have failed even in Europe. In Europe, where the citizenry has the capacity, because of their wage system, has the capacity to buy better health packages, more expensive health packages. Yet, it's been so costly that they are failing, even in America. These are failing systems. Why must people, because of their selfish end or selfish considerations, because of their pecuniary interest, would want to prescribe such failing packages to the Nigerian system? In 2016, they wanted to do it. We went on our own advocacy, and somehow the president also saw reasons that is not necessary, and he stood against it. Now they've come through behind the door again, and I pray that Mr. President will not fall for that trickery.
What are the implications of this hospital concessioning?
Now, once they concession the hospitals, it becomes more of a private entity. And you can also, you know very well that once the private entity comes into it, it becomes too expensive for the ordinary Nigerians to access. It cannot be available to the ordinary Nigerians. In a simple illustration, let me tell you now. Assuming you have a beautiful hospital, it has the state-of-the-art equipment. For staff, for manpower, I would say we lack any the manpower. We have that. Now it has all the staff that is needed, the manpower that is needed. Now, the common Nigerian walks into the hospital premises because it is physically available. We say he has accessed the hospital, not so. It's available, he has accessed it physically. But it gets to the point of getting the service dispensation, and it is not affordable. It's not affordable. Then he walks back. That simply means that, yes, the hospital was physically available, physically accessible, but it is clinically not available and clinically not accessible for the Nigerian common man, all because it is not affordable. So concessioning straight stabs into the thing that holds UHC, universal health coverage, together, which is the AAA, availability, accessibility, and affordability.
So looking at the issue of underfunding in the healthcare sector, would you say that this public-private partnership is a solution to ensuring that we have proper or adequate infrastructure in place?
Certainly not. Public-private partnership is certainly not the answer. The answer is eliminate corruption. 2, reintroduce the appropriate management system, where before 1985, where hospital administrators, hospital secretaries, and so on, were in charge of the hospitals. And every other professional, be it a medical doctor, a nurse, everybody was very much confined to discharging his professional calling. All right? When you get that, combine that with anti-corruption that eliminates corruption from the hospital system, Nigerians will be better off.
So are you saying now that there is corruption in the healthcare system, and that is the main reason why we can't get the best from the healthcare system?
Corruption and maladministration. These are two key things. Corruption is there in the health system. Let me tell you, even the SERAP, I've always been saying that the Federal Ministry of Health is a cemetery for corruption. And I still don't have any doubts about that. Because why I say it's a cemetery, when corruption occurs and the people in the health system tries to blow the whistles, and these people who blow the whistles are not rewarded positively by getting to the roots. When the Federal Ministry of Health do not get to the root of the matter and punish who is punishable, but rather turn the whistle to be an offense and start punishing those who blew the correct whistle to sanitize the system, then corruption has been buried. Why are they doing that? It's to cover up the corruption that has been sounded, the corruption warning that has been sounded. So the corruption is there. But rather than dealing with it, it has to be buried. And to bury it, you silence those who have reported it. For instance, like the case of Owerri.
Which are the workers?
Yes, the workers.
So how have your members been able to maybe blow the whistle or call the union or the government's attention towards such practices? And citing the example of FMC Owerri, how would you say the workers have been treated, or your members have been treated so far?
Very unfairly. My members have been treated very unfairly. And if not for our patriotic concern for the country, if not for our patriotic concern for the country, and we believe that it is only the public health institutions that can stand for the common people, we would have sealed our mouths.
So what are your solutions finally?
Solution, no privatization, take away corruption, increase funding, employ more hands, provide, in fact, reactivate the drug revolving funds.
It was an interesting conversation I had with you.
And it's a pleasure meeting you always.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember, labor creates wealth.